Once again, we want to welcome the expertise of Dr. David Klein to the Resource Hour right here. And Dr. Klein is with us 5 full days a week now. We have 3 of the shows, and we always throw in 2 bonus shows a week just because the audience loves this part of the show. They're learning. You know, they often wonder, they want to meet Dr. Klein. So one of these days, if you can't make it to Longwood, I'm going to haul him out to Lake County, and we'll just have a sit-down evening or something. But today we're going to talk about hand and foot pain. So let's dive right in.
Okay, of all the things, that will bring somebody into the office, in Florida, foot pain is number 1. Okay, there's an entire field of medicine that's devoted to foot pathology. It's called podiatry.
Mm-hmm.
You know, for God's sake, they don't get much respect, I got to tell you. But for the most part, that's all these folks do because the complaints are so numerous, the problems are so prevalent that guess what? There's an entire cadre of physicians that do nothing but podiatric medicine. So what kinds of things can cause hand and foot pain? Well, we can start with the skin and work our way all the way down to the bone, and we'll do just that. What are the sorts of problems in the skin that are likely to cause foot pain in this environment? Okay, we have bacterial infections, we have autoimmune disorders, we have vascular problems causing skin symptoms. Okay, the fungal problems being the most common. And so what will happen, okay, if in particular your thyroid is challenged, if your thyroid function is too low, about 1/3 of the population falls into this category, your nails will start to grow very, very slowly, and you'll see this in the toes first. The toenails will thicken, they'll yellow, and then they become infected with a fungus. Now, why are the nails supposed to grow at all? They're supposed to grow to throw off, to shed these bugs. And when they grow slowly or little at all, it sets them up for infection. As this infection sets in, the nails tend to bow a little bit, and you end up with ingrown toenails. Now, is this a big problem? Causes foot pain. Foot pain can cause you to limp, a limp will cause you to develop hip and shoulder pain, neck pain, and headache. So it's kind of like what happens in a horse. They call these things diagonals. You know, a right, hind pain, on a horse will cause left shoulder pain. It's just the way these things work in human beings, and that's the way these things go. So you have to look to the feet in every individual that comes in with hemifacial pain or headache on one side, because guess what? Left-sided facial pain, right-sided shoulder, left-sided hip, right foot. That is just the way that these things go. So look to the nails. So how does this happen? Very, very simple. It starts off as thyroid disease. So how can thyroid disease cause foot pain? Well, what else does it do? Okay, it causes entrapment of the nerves to the feet. Now, there are a lot of people that will come in and have pain in their 3rd, 4th, or 4th and 5th toes, and they'll be told, appropriately or inappropriately, that they have Morton's neuroma. That's an entrapment of the nerves. They'll be told that it's a growth. It isn't a growth, and it's an entrapment of the digital nerves. But what causes it? It's generally caused by the growth of the proximal metatarsals. Why does this happen? Arthritis. The arthritis starts to make the bones grow. They entrap the nerves, and guess what? You end up with foot pain. How do you treat it? Depends on who you go to. If you go to the podiatrist, they'll inject it. Now, you'll do that once. And you might do it twice, but you hardly ever go back a 3rd time because it doesn't feel so good, okay?
Ouch.
How does that help the bone go away? It doesn't, so inevitably it leads to surgery of the foot. They go ahead and cut the ligaments between the bones, open it up, splay the toes a little bit, and gee, away it goes. But very, very frequently, these things can be taken care of using topical anticonvulsants. You use topical gabapentin, not oral gabapentin, but topical gabapentin, top of the foot, pain gets better. Does it go away? No. You still have to lose weight. You still have to do something about the arthritis, but you would anyway. So what else do we look at? Better look at the thyroid for this one also because it does tend to make it worse. My favorite one, my favorite disorder of the foot, if you had to have a favorite disease, it's going to be shin splints. And then rightfully you're going to go, but wait a second, the shin is different than the foot. And I would have to go, yeah, but the foot bone connects to the shin bone, you know how it goes, okay? And the runners will develop these sorts of shin splints. People that walk a lot, okay, you never see a lot of walkers in the villages, and that's a good thing, I suppose, okay? But you end up developing tendinitis of the extensors to the toes. So as you walk, heel, toe, heel, toe, heel, toe, that's the difference between a walk and a run, by the way. A run is toe to toe to toe to toe. Heel, toe, you actually take the toes and roll them backwards. The extensors are what you allow to give yourself the push off from the back foot. That's how you propel yourself forward. The extensors then get beaten up through repetitive use, and it causes pain, swelling, inflammation in the shin, but this will cause pain in the top of the foot. So there'll be people out there that will discuss this. They'll go, well, gee, I don't understand why it makes my toes hurt, but it does it every time. What else will cause foot pain? Diabetic polyneuropathy will do it. Okay, so if you have sugar issues, the small nerves to the foot will start to become dysfunctional. They start to short circuit, per se. Okay, and then you can treat this very, very easily. It's done using anticonvulsants topically as well as orally, although the oral ones in this case are really the mainstay, and muscle relaxants, believe it or not. And can you monitor this? Yeah, what we do is we actually measuring it using a study called a nerve conduction velocity study, looking in particular at the small nerves of the foot, to include the sural nerve, and then you can actually watch the darn things improve with treatment over time. So when somebody says, oh, you got diabetic neuropathy, you're screwed, not necessarily. Okay, there are treatments, you can do it, and if you measure, you can improve. If you don't measure anything, you can't improve anything. It's true in business, and it's certainly true in medicine. So then we're going to move on to the hand. So what's the difference? Well, the anatomy is a bit different. Okay, the hand and foot have similar bones, similar tendon attachments, similar nerves. Basically, they're very, very similar. They differ because we walk on our feet and we grasp with our hands. But once upon a time, okay, we walked on all four. So in terms of anatomy and structure, they're very, very similar. The complaints are the same. Now, why would you end up with hand pain? What's the most common cause of hand pain? And you're going to rightfully come out and go, well, gee, I would think it's going to be something akin to carpal tunnel syndrome. And I would have to agree. Okay, carpal tunnel syndrome is extremely common when it's bilateral. Okay, you need to stand back. Okay, because the orthopedic surgeons love to operate on these things. This is bread and butter. But if you have it in both hands, bilateral carpal tunnel syndrome is pathognomonic, which is another way of saying it's most likely due to, highly likely due to thyroid disease. Hypothyroidism causes tarsal tunnel syndrome in the feet and carpal tunnel syndrome in the hands. In fact, women that become pregnant will develop something called hypothyroidism of pregnancy. It's extremely common. More times than not, this happens. And you will develop carpal tunnel syndrome with it. So when they go into their obstetrician complaining of tingling in their hands, the OB will rightfully say, oh, leave it alone, it'll go away after you deliver. Because more times than not always, but more times than not, the hypothyroidism resolves. But what other things will cause pain in the hands? Things that will drive you nuts. My favorite is one called de Quervain's disease or de Quervain syndrome. De Quervain's is a tenosynovitis of a muscle. It's a tendon that runs from the wrist to the thumb. Okay, and you'll know that you have this issue because you'll have a hard time opening a doorknob. You can't turn a doorknob. You can't open up a can. You can't unscrew a jar without causing pain. That is something that the doctor should ask you because that is something you would see with de Quervain's.
Sometimes we'll get calls on the 2-hour show that we do, weekends 96.5, Sunday afternoons, and we'll get calls from people that are talking about hand pain, and you'll often ask them what they do for a living.
Oh, you
and
betcha.
You'll say repetition of certain things are causing you that pain.
And it does a lot, okay? And de Quervain's is one of those things that's extraordinarily common in folks that use their hands for a living. So you might be somebody who knits, somebody who sews, somebody who bakes, somebody who works with tools, scissors, hammers, pliers. This is the sort of repetitive activity that will not just cause carpal tunnel syndrome, but it will cause de Quervain's. And what's important is distinguishing the two because the treatment is entirely different. If you have unilateral carpal tunnel syndrome and it's not being complicated by an endocrine issue, surgery is sometimes what you need to do. I will use topical keto GABA and keep people out of the operating room, but not everybody's my patient, okay? And that's just the way these things work, but that might be a surgical situation. But the very last thing that you would want to do would be to have de Quervain's, have it misdiagnosed as carpal tunnel because the difference is a 0.5 centimeter in the wrist. You really have to know your business to figure this thing out, but the treatment is entirely different. The outcomes will be entirely different unless you figure this out. And it gets back to something called cryptogenic pain, which we're going to discuss in another segment.
Yes, we are. And a lot of the topicals you talked about and a lot of the things that you say are available right there at the Stages of Life. They could be prescription, they could be nutraceuticals, but they're all in one place, and that is right there. Now, how do I get there?
That's right. All under one roof. Come on into Stages of Life Medical Institute. We are in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. Our phone number is 407-679-3337, and our website is stagesoflife.net. Our office hours are Monday through Thursday, 8 to 5, and we are also on Facebook at Stages of Life Medical Institute. But do come on in and get to know us.